Is the coronavirus pandemic making it harder to treat other diseases in Africa? UN agencies warn decades of progress in treating AIDS, malaria and other illnesses could be reversed. How do you decide what gets priority? This is Inside Story. Hello, welcome to the programme. I'm Bernard Smith. The coronavirus pandemic is putting enormous strain on health systems worldwide. In some countries, that means resources are being diverted from other treatments. Patients with illnesses such as HIV, tuberculosis or malaria risk having their treatment interrupted. Two-thirds of the global population living with HIV are in Sub-Saharan Africa. If their antiretroviral therapies are disrupted, it's feared hundreds of thousands could die. The head of the World Health Organization is urging all countries to ensure vital health services remain open.
This is an avoidable worst-case scenario and not a prediction. This model acts as a wake-up call to identify ways to sustain all vital health services. Despite attention being focused on the COVID-19 pandemic, we must still ensure that global supplies of tests and treatments for both HIV and TB reach the countries and communities that need them most. We should save people from both COVID and HIV and other illnesses.
In the latest figures, almost 26 million people in Sub-Saharan Africa have HIV. Two-thirds of them were taking antiretroviral drugs. Close to 500,000 African patients died of HIV-related illnesses in 2018. And the UN estimates nearly 700,000 additional patients could die within a year if therapies are disrupted for 6 months. The report warns of a return to the situation in 2008 when almost 1 million people died. Mother-to-child HIV transmissions could increase again, and the death rate would rise for the next 5 years. Let's bring in our panel. From Geneva in Switzerland, we have Shannon, Deputy Executive Director of the Joint United Nations Programme on HIV/AIDS, UNAIDS. From Johannesburg in South Africa, Dr. Regina Osih. She's a senior technical expert in tuberculosis and HIV at the Aurum Institute. And from the Isle of Wight in southern England, Marriott, Oxfam International's Health Policy Lead. Welcome, all of you, to the programme. First of all, Shannon, with you in Geneva. In Sub-Saharan Africa, what are the risks from coronavirus to those already living with HIV?
Well, I think the risks are many. This is such a dramatic and serious disease. And like the messages you hear a lot, we want to make sure that everybody can be protected from COVID as much as possible. So for people living with HIV, I think particularly as people are aging and people who have other conditions with their heart and with their lungs, we know that these are, risks for bad outcomes from COVID. So we want everybody living with HIV to really be able to understand what's happening with COVID, be able to take precautions to prevent infections, and importantly, be able to take care of their HIV and their regular health and their family and their well-being during these really difficult times.
And Regina, what are your concerns for people in South Africa living with HIV, their concerns from coronavirus?
Well, I think the concerns are similar. The one issue is that we have a lot of disruption of the healthcare services, and people may not actually present for care. And therefore, we're hoping that we have some alternate ways of delivering medicine so that people don't interrupt their treatment. As Shannon said, it really will be catastrophic if we get a whole bunch of people who were on ART before interrupting because of an interruption of healthcare services.
And Anna, with you as well, what are you hearing? What are people worried about as coronavirus begins to spread in Sub-Saharan Africa?
Yeah, well, we're hearing many of the same challenges from our country staff throughout Sub-Saharan Africa, but also in countries like India. Malawi colleagues, for instance, have told us about their concerns about border restrictions with their neighboring country, Tanzania, as this is a major supply route for essential medical supplies, including treatment for HIV and malaria and tuberculosis. In India, we're hearing about patients literally being turned away from public hospitals as they get repurposed for the COVID response. That's including patients with tuberculosis and HIV. So we're hearing about these challenges throughout our country programs at the moment. And of course, we know from our experience of working in countries like Sierra Leone during the Ebola crisis that actually some of the greatest challenges presented by Ebola were the excess mortality rates from other causes, including HIV, but also maternal and newborn deaths. So these challenges are very, very real, and we do need to learn the lessons of previous outbreaks, previous epidemics in protecting existing essential healthcare.
Shannon, what are the risks to people suffering from living with HIV if their treatment is interrupted?
Well, you know, we were worried about this from the beginning, and I think recently we were able to come together and bring a bunch of the HIV researchers together under the HIV Modeling Consortium and work with WHO and the Bill and Melinda Gates Foundation to really sort of try to put some numbers about what could happen to people living with HIV if we fail collectively to act. And what we looked at is if there was an interruption of HIV treatment services for everyone living with HIV in Sub-Saharan Africa, how bad could that be? And the models estimated, you know, we might have as many as 500,000 extra deaths from HIV just this year. Now that nearly doubles the number of yearly deaths in Sub-Saharan Africa when we want to be driving it down. And the number one reason for that excess deaths was this treatment interruption. Now, we know that that treatment interruption doesn't need to happen, that we can work together to problem solve, to understand where the risks are, where the breaks are, to mobilize communities and partners to make sure that that doesn't happen. But the cost of inaction is high. It's high in terms of lives that will be lost.
Regina, help us understand what happens to patients if patients living with HIV, if their treatment is interrupted. What are the practical implications of that?
Well, from a clinical standpoint, if their treatment is interrupted, they tend to have an increase in their viral load. So their HIV, which was sort of controlled by the treatment, is going to go up and the immune system is going to go down, which can actually put them at additional risk from COVID and other diseases. And then once they do that, and if they're taking, so what could happen also is that HIV patients could share medicines or sort of, try to pull their medicines on for longer than they should. So instead of taking one a day, they would take one every other day because they don't have enough to last them the time. And if they do that, it's going to be really problematic because that means that they will can develop resistance. And if they develop resistance, they have to go on more expensive, more difficult to access medicines. And it just creates a domino effect of a whole lot of things. And of course, our biggest message in the HIV community is that if you're undetectable, you actually do not transmit disease. And so, of course, there's also a risk, a follow-on risk of people who are now having viral failure or have a high viral load, who would increase the risk to others by transmitting more of HIV. And I think for TB, which we haven't really touched on, it's very similar. People will interrupt their TB treatment. And what happens is that if they're not yet at the point where they have decreased the amount of TB they have in their body, they will cough on other people, and those people will get TB. And there's an estimate from the Stop TB Partnership that there will be a quite high increase in number of cases of TB if due to the COVID epidemic, and because of the fact that people will not present for detection and therefore will be more infectious and will be more infectious in situations where people are quarantined at home. And therefore, there will be an increase in the number of cases of TB due to the COVID epidemic.
Anna, Regina has clearly laid out there the stark dangers of interrupting treatments for people with HIV. But with all the attention on coronavirus, how do you make sure those treatments aren't interrupted?
Well, I think we need an unprecedented commitment from world leaders in full recognition of these risks, that they must protect, well, not only protect, but actually expand access to essential services, essential health services at this time. So we need to see, I mean, as at Oxfam, we have called world leaders to double the amount of health spending in poor countries now. We know that those health systems were already well under-resourced. So we need that injection of money to protect and expand healthcare services. And we need the financing for COVID-19 to be on top of that. We can't see a diversion of existing spending on healthcare into the COVID-related response. We need to protect the gains that we've made over the last decade or so, significant gains that we have made. So we need that injection of spending on healthcare, but we also need it directed in the right way to protect the supplies of treatment and care. We need to expand our recruitment and training of health workers now and for the future. And a really important action that we're calling for, in line with the guidance issued by the World Health Organization, is to remove financial barriers for healthcare, for general healthcare, as well as for COVID-related treatment and care. We need to remove user fees now. Again, learning from Ebola, those financial barriers actually prevented people coming forward for testing and treatment, not only for Ebola, but also for other conditions and illnesses. So we really stand in partnership with WHO's call around the removal of user fees, and we need to see more governments committing to that.
Shannon, are you worried that the focus on coronavirus will mean we'll take our eye off the ball when it comes to HIV and other malaria or another major problem in Africa? Will they lose attention now, do you fear?
Well, you know, I think we have to be really vigilant about that. And we have to absolutely emphasize that we can't afford to take our eye off the ball for other essential health issues like HIV and TB and malaria. But we also need to be really pulling together to address COVID together. These are not in competition. They're actually, I think, can work together well. You know, we see some of the solutions, in addition to the global commitment that was just mentioned, is a lot of the solutions about how to do both, how to not overwhelm the healthcare system even more and make space for the COVID work by looking at flexibility and adaptation led by communities in the way services are delivered. We have seen a lot of creativity, making sure that people living with HIV can have 3 or 4 or 5 months of their own medications in their own pocket, so they don't have to go back to a clinic every month just to pick up drugs when they're healthy. We have seen innovative ways to reach and support people. In Sierra Leone, they've implemented a hotline where people living with HIV can call if they're about to run out of their antiretroviral medications and get those drugs delivered to their doorstep. So we know that there are solutions out there. There are solutions that can happen in the community, empowering community-led organizations, decompress the health system, and allow us to do both, maintain our HIV and TB and malaria programs, and also respond to COVID. But that takes commitment, it takes adaptability, and it takes empowering community-led organizations as part of the solution and as essential during these COVID times.
Regina, you mentioned before tuberculosis. Does having HIV make you more vulnerable to the coronavirus?
Well, at this point, it's not clear because not a lot of people with HIV have had coronavirus. I think that the experience in Sub-Saharan Africa is probably going to inform this. But of course, you don't want to have 2 concomitant illnesses at the same time, and especially 2 infections. So I think that it is definitely better to have a suppressed viral load. I just wanted to add a little bit on what Shannon mentioned in terms of the innovation that's happening. There's been a lot of innovation in terms of trying to keep people on their medicines. We're using alternate delivery methods like home delivery. We're looking at, we also use a lot of what we call a Pele box, which is like a medication ATM where people get a code and they can put it into the code and a little box opens and they get their meds. So we're trying to push a lot more people in what we call differentiated care so that they can get their HIV services uninterrupted, but not also be in touch with the healthcare system as much as they were before. So no long waits in the clinics and things like that. And I think a lot of the innovation is going to happen in the community level, in the places at the coal face of where things happen. And I think that is those are inventions and innovations that need to be funded and that need to be promoted. And I think that that's where sort of the response will lie.
Anna, is it a challenge to get a coordinated response to this in Africa? The response to coronavirus hasn't been so coordinated in many countries. Tanzania, for example, not so rigid as neighbouring countries. Is that a challenge? I
mean, I think those challenges are echoed across across the world right now. And in fact, I think that rich countries, just building on the points that Shannon and Regina have made, rich countries actually have a lot to learn from Africa about these community response systems. I'm sitting in the Isle of Wight where they're currently trialling an app for contact tracing. Yeah. And this all feels very new for us here. And I think that those systems that have been tried and tested in many African countries, we have a lot to learn from. But of course, we need a coordinated response, not just across Africa, but also at the global level. And we're hearing lots of positive sounds from many world leaders about an approach based on solidarity and coordination. And we really need to see that followed through into concrete actions, concrete commitments to ensure things like any successful vaccine or treatment that come through from all this investment being made at the moment are freely and fairly available across countries according to need and not ability to pay. So we need that commitment across Africa as well. We cannot be in a situation where the essential supplies, the essential prevention, and the essential medicines associated with COVID are simply go to the highest bidder. We do need a global solidarity effort based on need and not ability to pay.
Shannon, is there a risk that the COVID outbreak, the coronavirus, could lead to more people being vulnerable to contracting HIV?
Yeah, I mean, I think on a few different levels. One was already mentioned by Regina. Even an interruption with treatment alongside interruption in condom supplies could in itself lead to 20 to 30% new HIV infections over the next year. But I think even more importantly is talking about vulnerabilities. We know from the HIV response that HIV isn't all about health and healthcare. It's about what happens in real life, about the social context and the economic context. And, we're very, very worried that as people under COVID constraints start losing their income, losing their ability to feed their family, that over time this increases your vulnerability for being exposed to and vulnerable to HIV. And so we want to make sure that sort of the social fabric and social enablers are not so destabilized through COVID-19 that as we recover, people are forced to take actions and be exposed to HIV and other issues in ways that we just don't want to see. So it's really important to look at the whole person and say, what does that mean for making sure we get back to educating all of our young women? What does that mean to make sure that people have basic income and economic opportunities during COVID recovery so that they can be resilient and empowered and make choices for their life that help them also avoid contracting HIV?
Regina, what has South Africa learned in its approach to coronavirus from the AIDS epidemic? Remember, former President Thabo Mbeki was famously a denier of the seriousness of AIDS in South Africa, but the approach has been very different this time.
Yes, I think that, running the world's biggest ARV program has really helped the country to understand what it takes to actually do something at that scale. And I think that right now the government is relying a lot on science, on scientists, making sure that we're using modeling, we're using the data that we have to inform decisions. And therefore, it's a very different response than the response to HIV. Although in the time between Thabo Mbeki and now, of course, there's been a massive response and a massive uptick in how we handle HIV and TB. South Africa leads the way in so many different spheres in terms of the response to these two epidemics. And I think that with COVID, we're probably going to do the same. It's a country that has a lot of people who live in situations of poverty, and therefore, as Shannon was saying, people are going to lose their livelihoods. It's going to get very critical. And I think we have to decide that we have a solution that is going to be tailor-made for our environment. We cannot take a solution that's sort of a cookie-cutter solution from other countries. We're going to have to come up with our own path and have to come up with our own ways of managing COVID that are in tune with the type of realities we have on the ground and what's happening to our population. And with a really huge unemployment rate and a lot of people living with less than $1,500 a year, you really cannot close down the economy for a sustained amount of time without really providing some economic support. So it's going to be a big challenge, but I think that there have been a lot of lessons learned, and our nurses and healthcare providers are very in tune with what it takes to sort of do things at scale, and at government as well. And so I hope that things are going to work out and that we're not going to have too huge of an epidemic here.
And Anna, is there a concern that too much resource gets diverted towards coronavirus when the WHO says that, for example, 4 times as many more people will die from malaria than coronavirus this year, and the risk from HIV is still high? Is that a concern?
It's definitely a concern, and we're already seeing evidence of some donor agencies repurposing money intended for things like sexual and reproductive health care being repurposed for the COVID response. And that's a real risk. As I said, I think we need to see a surge in resources for health systems more broadly, but the COVID response needs to be seen as over and above that. Not competing in a coordinated way, but we do need that injection of resource. We know that rich countries spend on average around 70 times more per person on healthcare than poor countries. So we're already spending far too little on healthcare and achieving healthcare for all in developing countries. So we really need to see world leaders step up to the plate here, and we need to see a really concrete commitment next week at the World Health Assembly, where health ministers from around the world come together for their annual event, where they come together to agree resolutions. The responsibility resting on their shoulders right now has perhaps never been greater since the World Health Organization was first established. So we really need to see a loud and clear message from health ministers that they understand the need to protect essential healthcare spending, and to increase the amount of resources invested in health now. And I just also want to echo the point that Shannon was making. We need to see this as a twin crisis, a health and economic crisis. And that economic crisis is being felt so profoundly by those in insecure employment, by those living in poverty already. And those conditions are really going to impact on people's ability to respond, or the effect of COVID on them now. So we do need to see other responses in the form of cash transfers, other forms of social protection to ensure we're protecting the living standards of people, and that we're not going to see mass food insecurity. These are very, very real risks that will also impact on health outcomes.
All right, we are unfortunately out of time, ladies, but thank you very much for your insights. Thanks to Shannon Hayder, to Regina, Osih and Anna Marriott. And Thank you, too, for watching. You can see the programme again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. We are at AJ Inside Story, and I am at Jazeera Bernard. From me, Bernard Smith, and the whole team here in Doha, bye for now.